How do drive TB drugs interact with other medicines? Imagine trying to keep a busy city running smoothly with many different systems working together. That's similar to how drugs in treating drug-resistant tuberculosis interact with other medicines. When patients are on complex treatment regimens, especially with drugs like rifampin or rifabutin, these interactions can influence how well the medications work and how safe they are. Many drugs used in drug-resistant tuberculosis treatment affect the liver enzymes responsible for breaking down medicines. For example, rifampin and rifabutin are strong inducers of enzymes called cytochrome P450 enzymes, especially CYP3A4. This means they speed up the breakdown of other drugs, which can lower their levels in the blood. If the levels drop too low, medications like oral contraceptives, blood thinners such as warfarin or HIV medications might not work effectively. This could lead to unintended pregnancies, blood clots, or HIV treatment failure. On the flip side, some drugs can inhibit these enzymes, causing other medicines to stay in the body longer and possibly reach toxic levels. For instance, certain antiretroviral drugs used for HIV can interact with TB drugs, requiring careful dose adjustments. When combining TB drugs like isoniazid with other medications such as phenytoin for seizures, there's also a risk of increased side effects, including nerve damage or liver issues. Newer drugs like bedaquiline, which is used for resistant TB, are metabolized by CYP3A4. If taken with rifampin, which induces this enzyme, bedaquiline's effectiveness might be reduced. This is why healthcare providers need to be very careful when prescribing these drugs together. Treating both tuberculosis and HIV at the same time is common, but it adds complexity. Rifampin can lower the levels of some HIV medicines, making them less effective. To counter this, doctors might double the dose of drugs like dolutegravir, an antiretroviral, to ensure it works properly. However, some HIV medications should not be used with rifampin all because the interaction can make the drugs ineffective or cause harm. Monitoring is key. Patients on drive TB treatment should have their medications reviewed regularly, and blood tests might be needed to check drug levels. Sometimes, doctors adjust doses or choose alternative medicines to avoid harmful interactions. Women taking rifampin should also use non-hormonal contraception methods because hormonal pills may become less effective. In summary, drug-resistant tuberculosis drugs interact extensively with other medicines through enzyme induction or inhibition. These interactions can either reduce the effectiveness of treatments or increase the risk of side effects. Managing these interactions requires careful planning, close monitoring, and sometimes adjusting doses or choosing different drugs. Always tell your healthcare provider about all medicines, including over-the-counter drugs and supplements, to help prevent problems. For safe and effective treatment, healthcare professionals follow established guidelines and stay updated with the latest research. Remember, each person's situation is unique, so personalized medical advice is essential.